Then go ahead.
Our mission, Helping Parents Heal, is a nonprofit organization dedicated to assisting parents whose children have passed. Through support and resources offered, we aspire to help individuals become shining light parents, meaning a shift from a state of emotional heaviness to one of hopefulness and greater peace of mind. Helping Parents Heal goes a step beyond other groups by allowing the open discussion of spiritual experiences and afterlife evidence in a non dogmatic way. Helping Parents Heal affiliate groups welcome everyone, regardless of religious or non religious background, and encourage open dialogue. Attendance at this meeting is voluntary. We hope that participants will learn from and share with each other. Discussions here are confidential and not designed to replace traditional therapy or spiritual counseling. Zoom meetings run by leadership are not confidential. These meetings typically feature guest presenters and are posted on YouTube so that affiliate members worldwide can watch and benefit. Neither type of Helping Parents Heal meeting is designed to replace traditional therapy or spiritual counseling. Helping Parents Heal offers a wide variety of speakers, allowing parents to learn about many possible ways to heal. This includes presenters covering progressive topics such as afterlife evidence and connecting with our children who have passed. The views expressed by our guest speakers may or may not reflect the opinions of Helping Parents Heal leaders and members, so we ask that you take from their presentations whatever may benefit you personally. Welcome, everyone. We're so glad you're with us this evening, and thank you so much for being here, Tom.
Yes, thank you.
Thank you for having me.
Thank you, Tom. And I'm going to go ahead and read your bio so people will know just a little bit more about you. Dr. Tom Nehmy is a clinical psychologist with over 20 years experience and a passion for healing grief with induced after-death communication therapy. So that's IADC therapy that we were talking about earlier. Having had his own spontaneous after-death communications, Tom is now a visiting research fellow at the University of Adelaide, where he has conducted a controlled evaluation of IADC therapy. So he's done quite a bit of studies on this subject and about the efficacy of IADC in terms of helping people like us. He also runs a virtual practice, private practice, with a mission to make this extraordinary therapy available to anyone, anywhere in the world, from the comfort of their own home. Tom is the author of the book, the new book that just came out recently, Inspired Life, Beautiful Death, Healing Grief, Overcoming Fear of Death, and Living a Spiritual Life, in which he details his personal spiritual awakening and journey from being a therapist helpless in the face of grief to being able to profoundly help people with IADC. He has previously been awarded the 2015 Flinders University Vice Chancellor's Prize for Doctoral Thesis Excellence and has developed workshops and keynote addresses to delivered them to over 50,000 people worldwide. And without further ado, please join me and Irene in welcoming Tom Nehmy. I am so glad that you're here. Thank you for joining us.
Thank you so much for having me, Elizabeth, and for the very warm welcome. I really appreciate it. I'm just going to share some slides, if that's okay with you, as I tell my story, but I'm going to try to be very disciplined today and make sure that I don't waffle on endlessly. I want to make sure that there's plenty of time for you to ask questions and share your comments as well. I suppose I'm a bit of a mass of contradictions. I'm a scientist, I'm a researcher, I'm a clinical psychologist, but I'm also a very spiritual person. And I have been, and I recall having had a spiritual awareness since I was a child. That doesn't mean to say that I have any special abilities or there's anything exceptional about me, just that I was really aware that there must be more than just this physical reality. So I'll tell you a little bit about how I came to be a grief therapist, which was a massive turnaround from where my career was a bunch of years ago. and also share with you details of this remarkable therapy, induced after-death communication, which has not just transformed my career, but has really transformed my sense of purpose in life. And I'm very excited to make people more aware of this therapy and how it works. So can everybody see my main slide there? I'm sharing my screen okay?
Yes, I can. I think
Fantastic.
everybody can.
Great, wonderful. So really, my story is shaped around three critical events. One is that I felt really helpless when it came to helping grieving clients. So I was very comfortable treating anxiety and depression and all the other things that psychologists have to help people with. But I found that when people were coming to me in grief, I was certainly willing to help them in any way I could. I would sit with them in their pain and distress, but I just didn't feel like I had the tools I needed to make a substantive difference to their experience. And so I was a bit cowardly. It's not something I sought out. And I really was disappointed with my clinical impact that I had with those few people who were grieving who came to see me. I felt that they were disappointed in me probably in the end as well. So this was a big sticking block. There was like a massive gap in my toolkit. Then one day I was listening to a podcast. It was a Sandra Champagne podcast, who I know is a mutual friend of Elizabeth and me, and many of you may have listened to her as well. Sandra's a lovely, lovely person. And I was listening to her interviewing Dr. Alan Botkin. And I'll unpack a little bit more about Alan Botkin's discovery of IADC therapy, but I heard about this clinical psychologist from Chicago. I'm thinking, well, I'm a clinical psychologist. He's a clinical psychologist. He's on this spiritual podcast. I'm spiritual. This is really interesting. And he was talking about being able to help people in grief and being able to reduce their sadness and lighten their load. He was using an adapted form of EMDR, which I'll talk about briefly in a minute. But I'd heard of EMDR, but I'd never heard of IADC, induced after-death communication. This was the therapy that Dr. Alan Botkin developed or discovered. And I think the world owes him a huge debt of gratitude because, well, you'll find out more about why in a minute. And the third critical event in my life was that when my young son was a baby, he became critically ill. And I was at times really feeling very, very frightened about what might happen next. I won't go into the details of the medical side of things because that's his story to tell when he grows up if he wants to. But after some time in the hospital, we were told that the provisional diagnosis was not correct, and that in fact the doctors believed that they would be able to cure him. And I'm immensely grateful and blessed that that was in fact the case. But what it meant for me was if I was able to avoid this feared outcome, but yet I had the opportunity to help people who had experienced deep grief with their kids, then I felt morally obligated to pursue that. So for me, this was the point at which I committed myself to pursuing IADC therapy, finding out if it was in fact too good to be true. And if it was something that I thought could help people in grief, I made a decision that I must help people with it. When somebody passes, transitions, and I've got to declare my hand, I don't think of death as the end at all. I believe that we're in these physical bodies and it's like shedding clothing. But, you know, we use these common language in the broader kind of clinical world, death and dying. But for me, it's just a transition. But of course, people's fears are around the possibility that, you know, what if death is the end? What if our bonds with our loved ones are broken? What if they cease to exist and death is final? These are the fears that we in society have. And I think we can now alleviate these fears with an enormous body of scientific evidence that tells us, in fact, that death is just a transition. Part of the evidence for that is after-death communications. It's when somebody perceives the presence of a person who has transitioned to the other side. And I have to say, these are remarkably common experiences. These are really, really common in the general population, regardless of your beliefs. So some estimates in research say that it's probably around at least 30% of the general population. So if we were walking down the main street of any metropolitan centre and we just surveyed people, I'd be confident that at least 1 in 3 people would say yes if we said, have you ever perceived the presence of someone who's passed? But that has increased as much to 80%. And most people say that this helps them and it's comforting. So it kind of helps them in their grief. But medicine and psychiatry, and even to a certain extent clinical psychology, often refers to these experiences as grief hallucinations. I've got a real problem with that because the term hallucination invokes the idea of psychopathology as if it's part of some kind of disorder or problem. And I don't think it is at all. There's no evidence for that. People who have ADCs are very mentally healthy. They're people who are not suffering from psychiatric conditions. And really, they're completely the opposite of hallucinatory experiences in the clinical world, which tend to be often disjointed or distressing and things like that. ADCs are nothing like that. So I hope that in time we are able to shift the perspective of health practitioners, because if they pathologize these very natural, normal and healing experiences, these spiritual experiences, I would suggest, then it actually makes it harder for people to reap those benefits, and it's associated with poorer adjustment of those people. Thankfully, there's research going on that's going to help shift this. The University of Northampton's doing a major study on after-death communications, and there's a few other places around the world, including where I live in Adelaide. ADCs can take a whole range of modes or modalities, a whole range of sensory perspectives. They're often not what people expect, and they're not really something that we kind of control. They're something that happens to us. And that's what makes them really valid and really, really special. I didn't need to be convinced about after-death communications when I heard about induced after-death communication therapy, because I had already an after-death communication of my own. And in fact, I've had a total of 3 of those to date. I'll share these with you quickly because it gives a bit of personal context to where I've come from with this. Growing up, I was incredibly close to my grandmother, who I called Nana, and she was the kind of person I would wish every young person had in their life. She was just really unconditionally loving. Like, that's a term we use a lot, but it didn't matter what I did. She always said, Tommy's a good boy and I love him. And she always was there for me and looked after me. She gave me the benefit of the doubt, even when I was a rat bag. And as she got older, I had the opportunity to look after her a little bit. I'd go and visit her. I'd bring her dinner. And when she ended up in a nursing home, I would visit her regularly. So my nan passed at 84. And I always thought, being the spiritual person, I thought, well, if my nana is the closest person to me in my life, certainly at that time she was, I thought, well, definitely she's going to visit me. If there is an afterlife in a spiritual world, I'll hear from Nana. And a long time went by and I didn't hear anything. And I maybe it made me doubt things a little bit, but it was about 18 months, maybe a little bit longer than that, after she transitioned, that I was coming out of sleep one morning. I definitely wasn't in a dream, and I saw her. And she looked about 60. She was about nearly 25 years younger in appearance. She had this bright red lipstick on. Her blue eyes were really sparkling, and I felt this wave of love come over me. She didn't say anything, but she didn't need to. I felt her presence, and it was just a remarkable and comforting experience. Many years later, I had the same thing happen again when my grandpa died, my mum's dad, but he appeared to me much younger. He looked like he was in his 30s. Again, that was incredibly comforting. This happened only about a week after he transitioned. And then my mum's mum, when she passed, it happened again about a week after she transitioned. I was coming out of sleep. I wasn't in a dream. It definitely wasn't a dream. And I saw Nanny. She was 103 when she died, and I saw her looking about 60. So that's me poking my head up over her shoulder at a family dinner. I think it was a Christmas lunch or something like that. I probably would have been about maybe 7 or 8 years old there. And when I had the ADC with Nanny, I actually felt her. So she embraced me, and I felt the hug from her. It was a really physical sensation. And she had this immense happiness. It was like she was radiating that she was well and she was happy, and she wanted me to know how happy and well she was. So between the literature on after-death communications and near-death experiences, of which we have now thousands of case studies, we're building this body of knowledge that tells us about common features of people's experience. And for me, this is really useful data. Now, you can't do a randomized controlled trial where you put people through a near-death experience. So the scientific evidence we gather is a little bit more anecdotal. But of course, if you have enough anecdotes and there are consistent features of them, then that is absolutely scientific evidence. So we now know that we don't cease to exist, and I'm fully prepared to say that. We also know from people who go to the other side and are resuscitated that generally for them, dying is not a distressing experience. Our bonds are not broken. People usually do not regret having passed, not that they don't miss necessarily their former life, but they're in a state of wholeness and wellness and peace and love. This is the overwhelming theme of the evidence that we get. And in fact, they're living in a much freer, broader existence. And a lot of these NDE accounts tell us that people actually feel so good they don't really want to come back. Like they feel so good on the other side, and this is really comforting. This is really hopeful, not just because this is what we all have to look forward to, but also because our loved ones who have passed are in a really pleasant and peaceful state. So after listening to Alan Botkin that day, he described how he took eye movement desensitization and reprocessing, a very now mainstream treatment for post-traumatic stress disorder. And while working with Vietnam veterans, he tweaked it a little bit. He thought he could improve it. And the founder of EMDR, Francine Shapiro, encouraged her early students to experiment with their eye movement therapy. So EMDR has people move their eyes back and forth horizontally, usually. Sometimes they do it through tapping. And we know that this seems to stimulate alternate hemispheres of the brain. In doing so, it puts the brain into a healing mode. This seems to reflect the mode our brain's in during REM sleep. If you've ever seen somebody asleep and their eyes seem to be darting backwards and forwards under their closed eyelids, well, this is the rapid eye movement phase of sleep, which we know processes emotions. It consolidates memories. It puts emotional memories back in their place so they don't intrude on our consciousness when we don't want to recall them. And it was considered weird when it first came out. And when I did my clinical training 20 years ago, people thought EMDR was pretty weird. But it's now the gold standard for treating post-traumatic stress. What Alan Botkin did was say that in people who have been through a trauma but somebody passed, he calls it a loss trauma. And he said, in the case of a loss trauma, we shouldn't be focusing on the fear of the traumatic experience, but we should focus on the sadness. He said the sadness is at the core. And initially, his revised protocol, which had his clients focus on the most sad aspect of their experience, and then they'd have these sets of eye movement, he called this core-focused EMDR. And he said it did improve things. He was able to make even more rapid progress with his Vietnam veteran patients. And this was the birth of IADC, because one day, while doing his core-focused EMDR, a client he was working with had been very distressed, very sad. The sadness consistently reduced throughout this session. And that's something I have observed in doing this therapy, is people's sadness, their subjective sadness in that moment can reduce very rapidly. And he had added kind of another set of eye movements when this person was already feeling good. And under closed eyelids, they had a change in facial expression and they kind of became emotional again. But this first patient who reported this said he saw in his mind's eye the clear image of the person who he was grieving and who had died. And she said to him, "I love you." There was this kind of resolution of things. He felt immensely comforted by that. And in fact, he was discharged from the inpatient ward he was living on soon after. Initially, Dr. Al, as he's called, didn't really know what to make of this, but it happened again and it happened again. And eventually he realized what about his changes was probably predisposing people to these ADCs, and he systematized it. He then taught other people how to do it, and they had similar results. And this became induced after death communication therapy. It's considerably different from EMDR now, but it uses similar mechanics. It focuses on sadness, and it's really, really effective. It's the most effective therapy that I've come across. That's not to say it works 100% of the time, but it is quite remarkable in its efficacy. And about 3/4 of people will have one of these ADCs to some extent. It's usually not what people expect. Sometimes it's very brief and very subtle. Other times it's quite elaborate and intense. But we can't control that. I can't force that to happen for any of my clients. They can't force it to happen. And in fact, if we start trying to force it, it just tends to get in the way. So in a sense, the name of this therapy, induced after death communication, is a little bit of a misnomer, because the main purpose of the therapy is to reduce people's sadness. Of course, we're all very interested in the after death communication part. It's a fascinating phenomena. But because it's not the main objective, I usually tend to play it down a little bit when I talk to my clients. I say to them, my objective as a therapist is to reduce your sadness. And if after this therapy I check in with you and you say, yep, I definitely feel lighter, my average daily sadness is significantly lower, I'm able to think about and talk about my loved one, and it's not that intense sadness, I feel more peace and love and gratitude, then that's a big win. That's a success for me. If somebody has an ADC, which is also very common, then that's a bonus. I say that is the cherry on top. It doesn't really matter what people's beliefs are either. It's just important that people are really willing to step into their sadness. They're willing to tolerate that very intense emotion. So it isn't for everybody. It's a very intense therapy. And it's really just 2 90-minute sessions. So it's also the most brief therapy that I've ever worked with. In my scientific detective work that I was doing in preparing for my research study, because of course I wanted to prove this to myself. I wanted to know, is this for real? Is it as good as it sounds? I'd read Alan Botkin's book, which I usually have a copy. Here we go. So this was the original book on induced after death communication by Alan Botkin. It's called Induced After Death Communication. And I wanted to find out, is this too good to be true? Now, I have to let you know that I've formed the opinion that, it's probably Dr. Al's highlights reel, which is completely fair enough. He's going to talk about the most interesting and dramatic and noteworthy cases. But I later found there was a lot of substance. In fact, what he said was correct. This is quite a remarkable therapy. But I did find a published case of an induced after death communication that predated Botkin. And it was published by an EMDR expert called Dr. Laurel Parnell. In 1996, before Dr. Botkin had published his work on IADC, she published an article on spiritual experiences that happened during EMDR. Now, when my colleagues have gone to EMDR conferences talking about normal or standard EMDR and have asked the audience, these professional therapists, have you ever had something unusual happen in your EMDR sessions? Or have you ever had a client spontaneously report that they perceived the presence of a deceased loved one? Like half of them put their hand up. So there's something about this healing mode that eye movement can do that is just remarkable. So this is what Laurel Parnell published in 1996. She was working with a client who was distressed over a fire in which some of her friends at college had been killed in. And she was doing standard EMDR, but this is what Laurel Parnell wrote. She reported much relief, but still felt a great deal of sadness. So I requested that she stay with the sadness and continue the eye movements, even though she thought she had processed it as far as it would go. After a few minutes, she reported experiencing an image in which all of the women in the school had formed a circle and held hands. The women who had died slowly floated up into the sky as they danced happily. The client felt great peace and happiness with this imagery and remained with a feeling of closure with this issue. So almost without realizing it, she had administered, spontaneously a form of IADC. Well, this has now been studied scientifically. So Professor Jan Holden, who many of you may know as the president of IANS, she conducted a study that compared 2 sessions of traditional grief counselling with the 2 sessions of IADC therapy. And they found that IADC therapy was superior. This also featured in a feature-length documentary, Life with Ghosts. Many of you may be familiar with Stephen Berkeley, who is a lovely man, has been a wonderful encouragement and supporter of my work. So great film that. And that featured Jan Holden and some of the people involved in that. So what did we do here in Adelaide? Well, I wanted to contribute to the scientific literature. We need to help get this mainstream. One of the biggest problems, despite this movie, despite these other publications, is that it's still too obscure. People don't yet know, and not enough people know about IADC and know that it's an option. So we recruited people here in Adelaide, South Australia, to conduct a waitlist controlled trial. We screened people who were suitable for this therapy, or for whom the therapy was suitable for them, I should say. And we ended up having a total of 43 participants go through these 2 sessions. But we also made sure that we had a waitlist period of 1 month where we could collect baseline data. So this is a slide I presented at a scientific conference just a month ago. They had a 1 month baseline period where we assessed their grief and sadness. We assessed it again after a month. We gave them these 2 90-minute sessions. And then a month later, we did a follow-up as well. And we measured things like their grief symptoms on the International Prolonged Grief Disorder Scale and other grief measures, as well as their subjective sadness. We just literally asked them, how sad do you feel on average between 0 and 10? And this was a really pragmatic measure of their sadness as well. Well, let me show you what we found. So you'll see there on the left is the graph for global grief symptoms, and on the right is daily sadness. So you can see there that there's a marked reduction after that baseline period, no change during baseline, and then a significant reduction. These numbers may not mean a lot, but I want to explain them. In psychological research, if we want to know the impact of a therapy, we look for a statistic called Cohen's d. This is a measure of effect size. How strong is the effect of the intervention? And you can see there for grief symptoms, we had 1.56 was the reduction. Well, in mainstream psychotherapy research, 0.6 to 0.8 is considered really good. 0.8 is the descriptor we give to a large effect size. But in these 2 90-minute sessions, we had an effect size of 1.56, which really is almost unheard of, I have to say, in terms of regular scientific social sciences. So this was pretty amazing. And when you look at some of these other therapies, cognitive behavior therapy for anxiety and depression, these are interventions that would have involved maybe 10, 12, or even more therapy sessions. We're talking about 2 90-minute sessions. So 2/3 of the people who would have met diagnostic criteria for prolonged grief disorder no longer met criteria at our 1-month follow-up. It didn't matter whether you did it on Zoom or in person. You can expect pretty much the same outcome, which was just amazing because it frees us up to work with people all around the world, which I'm doing at the moment, and I just love that work. And we found that those who had reported an ADC, 1 month later, they were higher on what we called the continuing presence subscale. It was a measure of the sense of a continued presence of somebody who they were grieving. But we didn't need people to have an ADC in order for their sadness to reduce. That's really important. I think we can't emphasize that enough. This therapy reduces sadness, and the bonus is when people have an ADC. We also found that, sorry, I've just skipped ahead. So afterwards, sadness was no longer correlated with the perception of the presence of the person. Before IADC therapy, when people perceived the presence, it was associated with sadness. And afterwards, it wasn't. This was remarkable. So something had changed the nature of those bonds from pre to post therapy. And we also asked people after a month, tell us what you thought. Give us some feedback and some comments around what your experience was and what it meant to you. So I'll put some of these on the screen for you to read, because these were people filling it out. The data went into a database. They didn't have us standing over their shoulder. They could have told us to jump in the lake if they thought the therapy was no good, but these were the comments that they wrote. And I've got another page of comments as well. A renewed sense that I can do this. I can't wait to see my loved one in the afterlife, but I've got things to do first. Feeling lighter and more positive about my future. There's definitely a heaven or another dimension. So this, for me, is really important. We need to get this knowledge out into the world. This was also why I wrote my book, because I want to get this out of obscurity so that people can learn that this is available. I've never seen a therapy work as quickly as this. When I follow people up, and I always follow my clients up to see how they're going, have these gains been maintained? And they almost always say to me, yep, I can't believe that I'm still feeling lighter, I'm feeling less sad. One of the most frequent comments I hear is life-changing. People will say, this has been life-changing for me. Now, of course, that's not every client who says that. There is a range of responses to this. But when I compare this to my old life as a regular clinical psychologist, you'd just be grinding away for session after session, and people would get a bit better and maybe they'd relapse, and you felt good that you were trying to help people and they generally liked the experience of being listened to. But this is something much more substantive. So my mission now is to get this out into the mainstream. I think people are out there in society maybe a little bit intimidated by the name. There hasn't yet been enough research conducted. I have to say, our research is now under consideration by a major international peer-reviewed journal, and I've got my fingers and toes crossed that we will hear back any day that hopefully that has been accepted for publication, at which point we'll be shouting it from the rooftops. I think people are still entrenched in materialism and scientism. I think some people are maybe put off by the name a little bit, and we just need to also get the word out there a little bit as well. So, yeah, I'm glad that I haven't waffled too much. We've got plenty of time for your questions, and I'm happy to talk more about what IADC sessions involve or what it looks and feels like. Very happy to do that. Yeah, keen to take your questions too. I think we've already got some in the chat box there, perhaps.
Yes, we do. We have some questions, and I just want to say that I am so grateful that Sandra Champlain introduced us, because this research that you're doing is groundbreaking, and it's just such an important thing, because it is true that so many people go through therapy for years and years and don't seem to get better. But this therapy is so different, and the people in the book that talk about it talk about the fact that they have this renewed connection with their loved one on the other side, but they also don't feel like they need to join that loved one on the other side to be with them, that they have lots of things to do here. A lot of times they have like you did, a sense of urgency to help others. I think that also those the life review that a lot of people are going through when they do the near-death experience also makes them want to do as much as they can while they're here to help others. Because one of the things that you were explaining in the book is that in that life review, none of our degrees, none of our diplomas, none of the things that we think are important here count. The only thing that counts is the love that we show to each other and the kindness that we spread, and being able to reach a hand back and help someone forward is so important. So anyway, there are questions and comments, so I'm going to go ahead and start with Christine because hers is the first one. I'm a therapist trained in IADC, but I have also experienced IADC for myself for my grief, and I can say it was a powerful experience. I was so surprised at how healing the therapy was. I went from having major grief and PTSD symptoms to now I do not experience that anymore. And yes, it was very life-changing for me. So I guess that's not a question unless there's one underneath. Gayla is saying, I recently got trained in IADC too, currently not practicing. It was also helpful for me. Eric is saying, I'm currently working with a professional and using EMDR. I haven't seen much for results yet. Would IADC be helpful, and are there professionals in America that are trained on this? First, before you answer, I just want to also say this can be done by Zoom. So I know that Tom is willing to do sessions with people here in the States or in other parts of the world as well. But yes, could you tell the difference between EMDR therapy and IADC, and if it would be more helpful?
Yeah, thanks, Eric, for your question there. So I think it probably is quite different. I do have a number of clients I work with who either were having or have had standard EMDR. I got trained in EMDR for the sole purpose of becoming an IADC therapist. So I've never really done normal EMDR with people. And I think the differences are in standard EMDR, it's less direct. So you have kind of quite a lot of preparatory sessions. You kind of do your eye movement. It's kind of pretty spread out. We also in standard EMDR tend to follow what arises for the client. They kind of go on this trail of what comes up for the client. And in standard EMDR, if someone becomes very distressed, they stop and take them to a safe space and they calm them down. We don't do that. So in IADC, we're very direct. It's quite intense. It's even been described as an aggressive therapy because we deliberately take people into the most sad part of their experience. We do this repeatedly. People feel exhausted after it. But it's much more effective. And if someone's very distressed and you stop, you're withdrawing the therapy from doing its work where it's most needed. So we don't stop when people get very distressed. We say you must keep going. And this is why we do screening calls with people to make sure they're prepared for that. But the analogy we use is if you were driving down a dark tunnel and you felt uncomfortable or anxious, you wouldn't stop your car and get out of the car. You'd put your foot on the gas. And we say to people, put your foot on the gas, the therapist does the steering, and we will get to the other side. And we do. And for beginning IADC therapists, the whole thing's a bit intimidating because people are very intensely distressed. They're very emotional. And you're thinking to yourself, this better work. I hope we get through this. But you do. If you keep going, you do get to the other side. And the other thing that's different there, Eric, is in standard EMDR, when people start to feel better, that's when they stop, whereas we don't stop. When people start to say, I feel peaceful, I feel calm, we continue with sets of bilateral stimulation to try to expand those feelings. And it's as those feelings are expanding that people are most predisposed to an ADC. So I would say, yeah, IADC is significantly different from standard EMDR. I do recommend it, but I'm pretty biased. So I hope that's helpful. And in answer to your second question there, yes, there's heaps of people in America trained in it. There's a directory, induced-adc.com is the main, Alan Botkin's main website. And there's a directory, a trained therapist directory. Not every therapist who's trained in it is on the directory. I don't really know why. I put my name on it straight away. But as Elizabeth mentioned, because we know that the outcomes aren't different if you do it over Zoom. And Zoom allows people to do it in the comfort of their own home, in their comfy clothes, with their tissues and their glass of water, and it's comfortable for people. Yeah, like 90% of my clients are from the US. I've got a few from Europe and a few from elsewhere, but yeah, absolutely, that's all possible.
And I just want to also say that the Karen is saying that she had a session with you. It was amazing, and she lives in Colorado. So obviously it is possible to have a session. Could I ask you to take the screen sharing off so that we can see everybody? Is that okay?
Oh,
I
yeah, absolutely. And I
sorry.
do just want to let people see the
Oh yeah,
location of my
yeah.
website and my email if they want to get in touch with me. So healinggriefwithiadc.com is my home on the internet for IADC. That email is my university email, but you can also contact me through my website as well. So I just wanted to share that, but now I will
Well, that's
stop
important
my
too,
screen share.
because we have people asking how to get in touch with you to be able to book a session. And Irene put that other website up on in the chat box that you were describing, where not everyone is listed, but I am just so fascinated by this and by the fact that it has helped so many people and that you've been able to do all of these studies. So just recently, you presented this information, this research to the Psychiatrists Association of Australia, or I'm sorry, I, I just,
Very close. It was the Australian Psychological Society, their major conference in Queensland. Yes, that was like, I think 2 weekends ago, 3 weeks ago. Yeah.
and
Can I
so,
tell you something interesting about that, Elizabeth?
yes, I'd love to hear.
Well, so the room was filled with clinical psychologists mostly, and I said at the beginning of my talk, I said I just want everyone in the room to raise your hands, and so a few people were reluctant, but eventually I cajoled them, and everybody raised their hands, and I said I'd like you to keep your hand in the air if you've ever perceived the presence of a deceased person. And more than half of the people kept their hands up. So this was, a mainstream scientific setting. And when I've presented this likewise at the School of Psychology at the University of Adelaide, the audience warmed up a little bit over the course of my talk. And at the end of it, I had a number of them come up to me and say, let me tell you about my experience. Let me tell you what happened for me. It was so healing. And these are some of them hard-nosed academics. So that was really good.
Well, and it is very exciting that you wrote this book to go along with I don't know if it came out before your research or after, but it's just so interesting to hear case studies of people who have been helped by this. But also, I mean, there's someone who comes from the States to go through the therapy, which she didn't have to, obviously. It's possible to do so. And I think it's so wonderful that it only takes 2 sessions to be able to feel better, which is what all of us want to do. We all want to feel better. We all want to be able to experience our kids as though they're still here, which is something that I've been very lucky to feel from the moment that he transitioned. I felt this hug from the inside. You describe that with one of the moms that's there getting hugged by her son as well, and then just feeling so physically close to her son as well. I know that that's not something that you advertise as much as just the fact that it reduces sadness, but it is something that is very exciting for us as parents to hear that there is, first of all, a therapy that that takes into account the fact that we are all experiencing this after-death communication that's written about by Bill Guggenheim, as you explained in your book as well, Bill and Judy. And again, we've had him come to speak about Hello from Heaven a couple times on here, as well as the research of Dr. Raymond Moody and Life After Life. And it's just a very exciting thing, not only that you're doing this, but that you're in Australia and that you are obviously changing attitudes in the field of psychology with your colleagues, with the research that you're doing.
Yeah.
And
I wanted to just ask Tom something, if I could, Elizabeth. I just wanted to mention that when I had my session early, just a few years after, 2 years after my daughter passed, I didn't go into it expecting the after death communication. I wanted to heal from the trauma because I really feel that PTSD is very underlooked in grief, in early grief. And I describe it as the IADC I had was a bonus. I wasn't expecting it, but I felt that I healed from the trauma, and I found myself looping, remembering very upsetting memories. And I describe it as the loop went away and it just became a memory, a sad memory, but it no longer held the charge. So
Yeah.
I think for me that was just so beneficial, and the communication I had with Carly was a bonus.
Yeah, Irene, what you're describing there is a really important part of this mode of action of bilateral stimulation. Is people will have often intrusive memories. They often have what we call re-experiencing symptoms, where they feel like it's happening again. It evokes all the same emotions from the past. And what we know is that if we target those distressing memories with bilateral stimulation, people report often fairly quickly that the memory feels less intense, that maybe imagery can become even blurry. It's harder to see it, it's harder to recall it, and it feels much more like it's in the past. And so for someone who's been through a trauma and it intrudes on their consciousness day to day and they're reliving it day to day, that is such an important part of them being able to recover psychologically from that trauma. So yeah, it's not just about only the emotional part of the sadness, but these traumatic memories as well. So I'm so glad you got to have that experience.
Yes, it was very powerful.
I was going to also just ask, there's a question here that I think is really well thought out. Mindy is saying, I have received a lot of relief and benefit from meeting with mediums. How does this differ? Could you maybe give us an idea of what's different about the IADC therapy?
Yeah, absolutely. And I'm fully aware that many people seek out mediums and get comfort that from that. And I certainly in principle support it. I think the different thing here with IDC therapy is you don't have a medium. So you're having your own internal subjective experience of that connection with your loved one. That's probably the biggest difference. Some people find relief from a medium reading temporary. For some people, it might not be temporary, but for some, they might say, look, I felt so good after that reading, but it doesn't necessarily heal the grief in the long term. And if that was the case for someone, then I would want them to have a more permanent resolution of their distress. And of course, IADC, that's one of the things we aim to do, is that we aim to make a permanent difference for how people feel when they're recalling their loved one or talking about them or looking at their photo, things like that.
And that's very important. And I don't know if this is a question that I can ask, but Teresa is asking, what are the typical costs for two 90-minute sessions? Is it possible for you to give us an idea of what that would be?
Yeah, sure. Different therapists charge different things. I'm on the more moderate end of the scale. It's $200 an hour, and it's 3 hours. So the therapy itself is quite brief. So of course it's time limited, and the screening session, which is a 25 to 30-minute screening appointment, is at no cost. So people can, in fact, I get people to go through a pre-screening questionnaire. It's on my website, where they answer a few questions, and that helps determine if it's probably going to be suitable for them. And if they get 5 green ticks on the website, I say that they're welcome to book in for a no-cost screening call with me. And then we figure out, is this really suitable? We talk more about what's involved, and people can make an informed decision from there.
That's wonderful. Let's see. There are a few other questions, and I don't want to miss them before the end of the hour, but let's see if I can just. Steve is saying, I have PTSD from finding my son via undiagnosed autoimmune disease. I'm also suing the doctor. With that being said, I've been told that the pain I experienced with having some of the sting taken down, let's see, I'm not sure if I'm understanding this, Steve, how much could be lowered? I ask because I'll be testifying for a majority of the time. I am worried about not appearing grieving. Oh, okay. So that's an
I think I
interesting.
get what Steve's asking there. Yeah. Like how much of the emotional sting is going to be taken out if you had this therapy? It's different from person to person, Steve, and so we can't guarantee what the outcome's going to be. But for most people, they say that they feel less sad afterwards. And for most people, that seems to be permanent. Um, I worked with a client once who felt less sad after her sessions with me. And she said to me, I'm annoyed with you because now I feel less sad. I feel like I have to move forward in my life. And so there was this unintended consequence from not feeling as sad or not crying as much. And Steve, if you were to undertake this therapy, one of the outcomes I hope would be that you would feel less intensely emotional, you would be less teary on a daily basis, and yes, probably might appear less emotional if you were talking about your son. So our explicit aim is to reduce sadness in people. So I actually asked people in our screening calls, would you be okay with not feeling as sad afterwards? Because naturally, sometimes people feel ambivalent about letting go of their sadness. They don't want the pain, but they see their pain as their connection to their loved one. So we need to confront that and resolve that ambivalence in order to figure out if people really want to step into it. So, Steve, I hope I've clarified that for you.
Thank you. That sounds great. Bev is saying something that I think is interesting too. She's read so much and used resources about working through one's grief, is using IADC, maybe shortcutting those methods.
Bev, I think it is shortcutting the usual approaches. It's so much more direct. It's so much faster. I think I wrote in my book that sometimes I can't remember exactly how I worded it, but I said that sometimes our talk therapies can perhaps inadvertently be complicit in maintaining the distress a little bit, because we can be indirect. We can dance around it. We focus on how can I make someone leave the office feel good right now, as opposed to what is at the underlying core of their distress day to day. And Alan Botkin called his first version of IADC therapy core-focused EMDR, because he said we need to go into the core of the problem, which is that intense sadness. And I've had clients say to me, one lady who actually I think her is one of the 9 case study chapters in my book, she said to me, I appreciate the fact that this was so direct. You go directly into it. And it can be relentless, it can be intense. But she said, that was refreshing for me, because it wasn't just kind of talking about how can I manage these kind of surface feelings or symptoms, if you want to call it that, of distress, but it actually went straight into the heart. And she said it was tough and it was intense, but I'm grateful for that because it was so direct. So we find that we kind of like speeding people through. It's almost like you speed up the grieving process. That's one way it's been described, Bev. We're turbocharging it and we're going through as much as we can, as quickly as we can.
Wonderful. Jessica's asking, can we do IADC within the first year of the passing of our child?
Jessica, you potentially can. I usually recommend at least 12 months. It's different for everybody. We would be loath to take on a client before at least 6 months, because people are still in that phase of finding their feet. They're still in that phase of just getting their head above water and coping with day to day and trying to grasp the new state of their life. And sometimes in the short term, we're not directly sitting with and stepping into the sadness, perhaps. Sometimes we're just trying to get through the day and we're pushing it aside. Well, that's adaptive for people in the short term, but we don't want people to be pushing it aside when they're doing this therapy, because we need them to step right into it. So it's not a very clear answer, Jessica, but technically, yes, you can do it within the first year of your loss. I wouldn't necessarily recommend it. I would say after at least a year is usually better. I have seen exceptions to that. And the reason is we want you to get the best response possible. We want to have the strongest effect for you. If we did it too soon, we run the risk that maybe it's just less effective than it would otherwise be. Now, that's not the end of the world. It just means, okay, you've got a bit of benefit, but you may then need to revisit it with additional therapy later. So I hope that clarifies it, Jessica.
Thank you. That's wonderful. And Lisa is asking, I have heard of using psychedelic drugs like Silbicin or MDMA with PTSD. Do you advocate for this? Is this used with the MDR?
I don't advocate for it, Lisa, only because I don't know enough about it. So I have some of my clients who've used psilocybin, looked at MDMA. I know that in some states they're very much controlled substances, in others they're not, and some research is being undertaken at the moment. I don't know enough about it to offer a comment. So yeah, sorry, I can't help you with that one, Lisa.
Thanks. And Kim I think this might be our last question, but Kim is asking, would the pre-screening you mentioned determine if a person was not in the right place to do the therapy yet? So I guess that's the reason you do it?
Yeah, that would be one of the things we'd want to determine is, are there any kind of red flags that it might not be the right time for someone? And we go through in a fair bit of detail what's involved to make sure that people feel like they're ready to do that. So absolutely, Kim, that's the purpose of the screening call.
Wonderful. And maybe if you would just like to wrap up a little bit and tell us a little bit more. I just want to tell everyone that this book is really easy to read, but it's also an audiobook too, which I know everybody wants. So it's a really fun book to read. There's nothing sad in it. I mean, it's basically only this therapy that's helping so many people, and that I've heard about for such a long time, especially from Irene in the very beginning when she had Carly pass. And so, and then plus her sister Judy does a form of EMDR, which is the Shiomi healing sessions that she does for us. So anyway, if you would like to just say a little bit to sum up what you were telling us, that would be wonderful.
Sure. This is a really hopeful message. There's reason to be hopeful when we're experiencing grief. There's a lot that we can do to reduce sadness for people. And I just want to help get the word out. I see this now as part of my mission in life to make this available and to provide it. So my heart goes out to everybody on the call. I just love helping parents heal. Elizabeth, what you're doing is amazing. It's, I think if I can do my small part to assist and to be supportive in your community, then I want to do it. So just thank you so much for having me.
Thank you. And it's not me or Irene or any of us, it's the kids. I swear these kids are just amazing, and they bring the most wonderful people to our group as well. And I am so grateful to have been able to speak to you. It's tomorrow in Australia right now. And thank you for being with us on the 6th in Australia. And again, we always ask everyone to unmute and to say thank you and good evening. If you guys would like to do so, then go ahead and do so.
Okay.
Thank you.
Thank you.
Thank you so much.
Very interesting, Tom.
Yeah.
Thank you,
Thanks for having
everyone.
me.
Thank you,
Thank
Tom.
you.
Thank you.
Really
everybody.
interesting. Have a
Cheers.
wonderful
Hi,
evening.
Karen.
Thank you
Hi,
so
Tom.
much.
See you. Lots of love.
See you.
Thank you.
Bye, everyone.
Bye, Tom.
Thank you.
Bye-bye.